Hi everyone, welcome back to Renegade Healer. My name is Kate Mooney, and today I want to respond to kind of a topic that several people have reached out to me about in the last week or so, asking my thoughts and maybe to talk about it. And I can't, for obvious reasons, you've heard me talk about screen time a lot. I can't individually respond to everyone, but I think it's a worthwhile topic. And the topic is kind of navigating the differences of opinion or the opinions of our healthcare providers, specifically when it comes to the mood symptoms and mood disorder diagnoses that often follow a head injury. So I think there's a couple of really important things for me to say right off the bat. Every person's experience is completely different, and in some cases, following a head injury, there is absolutely a mood disorder that does develop. That may be because of the actual organic injury to the brain, or that may be because it's traumatizing and it's a hard recovery, and it's very natural to experience depression after such an experience. But in some cases, what happens is that our care providers become convinced that the symptoms we are experiencing that we feel maybe are more physical or cognitive, they become convinced that they are mood symptoms. And that can be really difficult because that can take you down the road of being asked to try medications that you're not really comfortable trying, or it can lead to diagnoses that you're just not comfortable having on your medical record. And one of the things that I have quite a bit of experience with is coaching people in self-advocacy. So I want to talk about that. And then something that has recently kind of really clicked for me, I want to talk about too. So first, let me talk about self-advocacy. We tend to go into our relationships with our healthcare providers and we put them on a pedestal. And sadly, sometimes they put themselves on a pedestal too. But it always is our best strategy, no matter what kind of person and personality we're dealing with. It's always our best strategy to try to build a really good relationship with our healthcare provider. So one of the ways that we can do this after head injury is going back to one of my initial recommendations. Start journaling and tracking. Track your symptoms. Track what exacerbates your symptoms. Track the kind of activities that you're doing on days when you're doing well and on days when you're doing poorly, so that you can have really good conversations about what's happening for you day to day. And you may be able to start drawing some conclusions yourself about what's happening for you. So, in some cases, your doctor may say that your confusion, and this has been my experience, that my confusion and my difficulty with word finding are mood symptoms. And I really disagreed. Now, I do have a good relationship with my practitioner, and she is a very good listener and thoughtful, but we really were having to go back and forth about this quite a lot. And I was very convinced that these were cognitive symptoms. They've been the same since the beginning of the injury, but they are become more or less intense based on my fatigue and the demands that are placed on me. So we were really stumbling along because I felt that what she was telling me was that this was not about my brain injury. This was about a mood disorder that had developed as a result of the brain injury. So just take a minute to digest that, because I'm going to come back to that in a moment. The reason that tracking the information and journaling was so important was that when each time I went to an appointment and for you, the reason I'm making this suggestion is so that rather than just simply saying, no, I disagree, I don't believe that's the case, you can offer your content, and it's a much more kind of balanced kind of hierarchy of power, I guess. It's not just opinion against opinion. It's your doctor and you having a conversation, deliberating over the material that you have created. So, and then you also have to be really careful and responsible for fostering a good relationship. And we are all aware that sometimes we have to navigate people's personalities. So depending on your doctor, your healthcare provider's personality, it may take a few visits. It may take you kind of asking some really specific questions about why do they believe that this is what's happening. And in the same moment that you are trying to get your valid points across, be open to the fact that your provider may have valid points too. So that's kind of my little tidbit of self-advocacy today. With regard to moods disorder and mood symptoms after head injury, I would like to offer this. It may be that you have developed a mood disorder. That's valid. It may be that you have not developed a mood disorder. And this is the thing that really, really came clear for me recently. It doesn't matter. Sometimes the brain, as it's recovering from a brain injury, behaves in the same or similar ways to a person with a mood disorder. The thing is, there's very little that we can do to really speed the healing or promote the healing of the brain. Now, I'm not saying that very well because there's lots we can do. I've mentioned things, in terms of us taking control and, fostering the connections and the reconnections and the pathways and the structure for the brain and really creating a healthy opportunity for the brain to do its work. Yes, but we can't really do treatment medically unless, there's reason for them to actually do something invasive. If your trauma is that severe, well, that's a different story. But when we're talking about just recovering from post-concussion syndrome and mild to moderate brain injuries, they can't really do a lot. But what they can do is treat the symptoms. And what we have available to try to treat these symptoms are the medications that are used for mood disorders. So it's kind of that question about how far are you willing to go? And that's a very personal decision. My opinion is do whatever it takes. That might not be your opinion, and that's okay. But I think that this way of viewing it is not that you're not embracing the idea necessarily that you have a mood disorder. If that makes you uncomfortable, that's okay. But can you acknowledge that your brain is behaving in a similar way to a person with a mood disorder, and that perhaps you could get some relief or some help from medication? For myself, I work in mental health. And yet, being asked to consider mood disorder was hard on me. I don't know why, really. Maybe just because it was scary. But it took several months, and then finally it got to a point where I embraced the do whatever it takes idea, and I said yes. What I have found is that the medication does not necessarily help my cognitive symptoms, but it does help me cope. On the days where things are flaring up, where I'm really feeling lost, I don't feel quite so much of that desperate, lonely feeling. And I think that's the medication. I'm on a very, very low dose, but I'm happy with that decision. Again, I'm not telling people to take medication. I'm just sharing my experience because I'm hoping that for some people who are struggling, it could be helpful. That's really all I wanted to talk about today. But I want people to walk away with those 2 points in their head. One, don't view your practitioner as an adversary, even if you're having disagreements. View them as somebody with whom you need to build a relationship and create some conversation. Number one. Give them some credit for the validity of their points, even if you disagree, because that's what you expect them to do for you. And finally, don't worry about whether this is a mood disorder or not. Ask yourself, is it possible that what's being offered could be helpful, could be a useful tool? And the kinds of questions to ask are, what would the side effects be? What would the risks be? How long do we need to try before we can reasonably decide whether it's useful or not? If I needed to, example medications, if I needed to withdraw, if I decided I didn't want to continue, how would that look? These kinds of questions. So I hope that's helpful. I know it's very brief for a very important topic, but I really want to keep these segments brief and manageable. And I want to remind people, you don't have to watch, you can just listen. And finally, I really would love to know that people are following and sharing these videos, because I feel like as we move along, I'm going to be able to offer more and more. And as I heal, I will start to be able to respond as well to people's questions, and that's really quite thrilling. So please subscribe and please share with people as you feel is appropriate. And I'll look forward to speaking with you tomorrow. Rest well.